Namaskar. I am Dr. Rakesh Chawla, Chairman, Senior Consultant, Department of Respiratory Medicine, Critical Care, Sleep Disorders, Interventional Pulmonology and EBUS program at Saroj Super Specialty Hospital, Sector 14, Rohini, Delhi. So in our next series of program after asthma, I am going to give you inputs for COPD. The question is, what is COPD? COPD is a chronic obstructive pulmonary disease. You call it as chronic obstructive lung disease. You call it as a chronic obstructive airway disease. This is a synonym of each other. What happens in COPD? Again, as we have told you, asthma is an obstructive disease. COPD is also an obstructive disease. But the difference between asthma and COPD is that asthma is reversible airway disease when we do spirometry after giving the bronchodilator challenge. But COPD is irreversible when we are giving the patient an bronchodilator challenge after doing a nebulization. So spirometry is the gold standard which decides whether the patient has got an asthma or patient has got a COPD. What are the types of COPD? COPD is generally an umbrella term. It will include emphysema and chronic bronchitis. Emphysema is a permanent damage to the basic unit of lung, which we call it as alveoli. And these alveoli, if you see the lung dia or the surface area of the lung is as big as the tennis court. So the basic unit, the last unit which takes part in ventilation का मतलब है जिसमें सांस का आदान प्रदान होता है, ऑक्सीजन कार्बन डाइऑक्साइड का आदान प्रदान होता है, उसको alveoli कहते हैं. In emphysema, that basic unit is destroyed and that is what we call it as an emphysema. Second is the chronic bronchitis, in which patient has every year, same time, cough, expectoration, breathlessness, wheezing, difficulty in breathing continuously for 3 years. So we call this as chronic bronchitis, or it is an emphysema, which is more like a pathological term. So to cover both of them, generally the layman uses the word COPD. What are the causes of COPD and what are the risk factors for COPD? COPD is caused primarily by the smoking. That smoking may be a chula smoke, which our ladies in the villages burn the fuel, burn the wood to cook the food and cook your vegetables on a chula. And they are, if you have seen the common pictures, they will be having small pipe also. जब आग बुझ जाती है तो उसको जलाने के लिए बार बार फूंक मारती है. So that smoke also is dangerous and the ladies suffering from COPD without smoking. Smoking is the single known cause for COPD. So smoking, which is because of the nicotine and the chemicals which burn. Now, you are doing cigarette smoke, you are doing a pipe smoke, or you are doing any other form of the tobacco smoke. Now when you are exposed to the smoke, it may be the primary smoking, that you are a smoker and exposing your lung directly to the tobacco products. The stimulant in tobacco is the nicotine. Second is a second-hand smoke, that I am a smoker and my surrounding area, my friends, my sister, my brother, parents, children are in that atmosphere. They inhale the same smoke. This is a second-hand smoke. Now, there is a new term now as a third-hand smoke. What is this third-hand smoke? I am smoking, I am sitting in a chamber, I smoke, I exhale and leave the smoke in the atmosphere. And I leave that room and go. Now that room has got the suspended particles of the smoke And when small children or anyone enters in that area, in that room, now he is inhaling the same air. This is what is called as a third hand smoke. That is why the developed countries have made offices, have made corporate offices, airport lounges, have made a separate smoking areas so that you don't get exposed to the second hand smoke or to the third hand smoke. Usually the COPD, which is a smoke related disease, develops after the age of the 40 years. But there is a type of COPD which is genetic, in which there is an alpha 1 antitrypsin deficiency. This is a genetic COPD which is because of this enzyme deficiency. But 90% of the time COPD is tobacco related smoke in any form: hookah, bidi, chillum, cigarette, cigar, pipe, you smoke. And there is a big myth that bidi is better than the cigarettes. No, bidi is more dangerous than the cigarettes. At least you have a cigarette, you have a filtered smoke, which the butt, which you call it as a butt, it is filtering that smoke. But bidi is more dangerous. That is a big myth. Now, do you know the interior end of the cigarette which is burning? The temperature is 934 degrees Fahrenheit. Imagine a poisonous product burning at this temperature, and that smoke which you are inhaling contains minimum 5,000 to 7,000 carcinogens. And tobacco smoke is directly related with the lung cancer. So these are two major diseases which are related with the tobacco smoke. What are the symptoms? These smokers have a smoker's cough, which is normal. Any smoker will have a smoker cough, but the cough which does not go away, there is lot of mucus, patient has got difficulty in breathing, patient has got the wheezing sound, patient has the tightness in chest, patient feels low energy, patient is losing weight, and patient has got swollen ankles, feet and legs, which is the advanced stages. When the COPD has taken over on your body, it is involving the other systems like cardiac and kidney, which are leading to the failure of the heart and leading to the swelling of the feet and ankles and the legs and your face. How you diagnose COPD? As I told you, spirometry is the gold standard to diagnose COPD. So, in the beginning of the talk, I have said that reversible airway disease, doing post-bronchodilator challenge with nebulization and doing a spirometry is asthma. If it is irreversible, we call it as COPD. So, again, peak expiratory flow meter is a handy tool to tell you how your lung functions are when you are normal and smoking, and how the lung functions are deteriorating. Other investigations which help you to diagnose COPD are the X-ray chest, which will be typical of the patients who are the smokers, and there are typical features in X-ray which clearly show that patient has got emphysema. Then you have to do an arterial blood gas to see how much carbon dioxide is getting collected in the blood secondary to the smoke. And you need to do, as I have told you, there is a genetic COPD where we do the measuring for alpha 1 antitrypsin. How you plan a treatment? There is no cure. Correct. You have heard rightly, there is no cure. You stop smoking. Stop smoking, not reduce smoking. When you stop smoking, it may take another 6 months to 1 year for reformation, or you can say the reversal process, or making you stable. But whatever damage is done, whatever emphysema is done, it is all permanent. So there is no cure, but you can treat yourself. As I told, asthma has no cure. COPD has no cure. So you have to make the things stable, and you can live your life absolutely normal. So, to save your family, to save your life, to save your children's future, please, please, please stop smoking. Thank you very much for watching. Thank you.